Hi, I'm Dr. Lauren Bull. We are going to have a quick talk about endometriosis. What is it, first of all? So endometriosis, the endometrium is the inner lining of the uterus or the womb. So endometrial cells make up that lining. And what happens in endometriosis is those same cells are found in parts of the body other than the uterus. So, for example, they may be on the ovaries, they may be within the pelvis, they can actually be found anywhere in the body with the exception of the spleen. So I want you to remember that. It's the same type of cell as lines the uterus found in parts of the body other than the uterus. So just going back to some statistics first of all. So it is the second most common gynecological condition and it's actually as common as diabetes. So 1 in 10 women have endometriosis. It's actually a very difficult diagnosis to make because the symptoms can be quite non-specific and there isn't a specific marker or test to prove that you have it, and because of a lack of awareness and because of stigma, quite often women go on suffering for long periods of time before the diagnosis is actually made. Now, this year there was actually this year being 2020, a cross-parliamentary report into endometriosis, which showed that the average time to diagnosis was 7.5 to 8 years. And 58% of women had been to their GP 10 times with symptoms before they were given a diagnosis, and 41% of them more than 15 times. 43% of them had attended hospital appointments before diagnosis more than 5 times, and more than half, 53%, had attended A&E with their symptoms. So you can imagine this amounts to an extremely frustrating experience. So if you imagine what the symptoms of endometriosis might be, so it's the same cells that line the uterus, not inside the uterus, but they're going to behave in the same way. So with your menstrual cycle, what happens during the course of your menstrual cycle is the endometrium builds up, ready to receive a fertilized egg if it were going to come. And when that doesn't happen, those endometrial cells then shed away, and that's what causes your menstrual bleeding. So those cells are going to behave in the same way. They're going to build up and then they're going to shed away. So this is going to cause things like pain, as you could imagine. So you can get extremely strong period pain, affecting quality of life in its strength. It's horrendous. It can cause chronic pelvic pain because of all sorts of problems where they are and because of adhesions that might form. It can cause deep pelvic pain during and after sex. And this might be because of the position of where the endometriomas are. It could be because of adhesions. It could be because of pelvic tension as a whole. There's lots of muscles in the pelvis. And it can also cause, for example, cyclical gastrointestinal symptoms. So if it's affecting the bowel, you might get symptoms that are cyclical but affecting your gastrointestinal symptoms. And these might therefore be misdiagnosed as things like IBS, irritable bowel syndrome. And women who suffer from endometriosis will use terms like it feels like they're wrapped up in barbed wire, it feels like their insides are going to explode, like their pelvis is on fire. So actually about 20 to 25%, so a fifth to a quarter of women who have endometriosis don't have any symptoms. And actually the severity, so the amount of endometriosis is found, doesn't actually necessarily correlate with the severity of your symptoms. So what causes endometriosis? Well, unfortunately, given that it's a problem that affects women, there's not been a huge amount of research done into it, so we're not entirely sure of the causes for it. There have been theories, for example, that you might have something called retrograde menstruation, which is when the endometrium is being shed, so you're having your period. Some of that might travel backwards, so retrograde, through the fallopian tubes and into the pelvis. But actually, retrograde menstruation is actually very common. So that's unlikely to be the main contributory factor. And we don't understand, it's not well researched why some people will have such different symptoms with less severe disease. There is definitely, like most things, a genetic predisposition, which in some ways can make things worse for the woman, because, you know, there's that kind of feeling of, well, that's just how periods are in our family. You know, mum had them bad, gran had them bad. We just suffer. So women just are led to believe that that's just what they have to live with. It's just the way it is for them. So how might you diagnose endometriosis? So obviously some of the symptoms there that I've described, and obviously doing an examination, so a pelvic examination, so popping a speculum in and examining the fingers might elicit certain types of certain signs or tenderness. An ultrasound can be helpful, particularly to rule out other causes. Sometimes it can clinch a diagnosis, for example, if you see an endometrioma on the ovary, but it can also help rule out other causes that might be causing things like heavy bleeding or pain during sex, etc. If there's a very likely diagnosis of endometriosis, and particularly if surgery is being considered, there should be an MRI scan, particularly if it's complicated, looking at involvement of the bowel and things like that. Actually, the gold standard way to diagnose endometriosis would be to do a laparoscopy, so keyhole surgery, looking inside the pelvis. Now, as you can imagine, given its commonality, that's not something that's going to be straight away offered to every single woman who's suffering from these symptoms, and nor would most women would probably want to undergo a surgical procedure. So we have to think a little bit more pragmatically about how we might manage things in the first instance. So that might be, for example, taking the contraceptive pill, particularly continuously. I'll do another video about that. You do not need to take it for 3 weeks or 1 week walkway. So you could just take it continuously, or using other forms of contraception, hormonal contraception, like the progesterone-only pill or the Mirena coil. Moving on from that, you can consider things like GnRH analogues, which essentially kind of simulate a medical menopause. You can use progesterones like Provera. And there's also a whole host of complementary therapies that might be involved. For example, following something called the FODMAP diet, which is something I'll discuss in another video. Things like acupuncture, CBT, hypnotherapy, reflexology, mindfulness, all those things that can help manage a chronic pain scenario. So what should happen, and particularly what's come out of this cross-parliamentary report, is that any known or suspected case of endometriosis should have access to specialist nurse input and should be referred to hospital. What your GP should be doing as a minimum is acknowledging your symptoms. I hope this video has done something to explain why those symptoms are caused. You could consider a trial of the pill in the very first instance to see if it makes your symptoms better, and they can refer you for an ultrasound to rule out other causes, and then refer you on to hospital if needs be. I also recommend you would have a look at Endometriosis UK, the charity, for more information. So hopefully what this video has done is to tell you about the very common condition of endometriosis, the sorts of symptoms that you might experience, and to reassure you that the struggle is real, and your symptoms should be acknowledged, and to not just suffer in silence. Please do go and see your GP in the first instance to look towards getting it managed.